The observer would like to advise that the following video comes with a trigger warning. The content in this video is of a sensitive nature, so please beware that the topic of this video may trigger you. The observer recommends that you consider your own mental health before you watch this video.
Yeah, I tell that's it, yeah.
So that's not really, I don't know, love. I can't really help because I'm not in that position anymore, but yeah. I can't really remember what I used to either. I used to always carry around salt sachets, obviously. And compression socks and that sort of thing. But yeah. I only got diagnosed with POTS a couple of years before I became paralysed, so I was quite old when I got diagnosed with POTS. I say old, obviously I'm still young, but it wasn't that long ago I was diagnosed with POTS, shall we say that. It's been about 4 or 5 years, and I've been paralysed 2 of them, so I can't remember exactly. That's really just got a crack in it, okay, weird. Yeah, when they're down your throat, but have you ever had what are they called? Nasal pharyngeal airways, when they're down your nose. And obviously I've got tubes up my nose as well. And they put an airway down your nose, down to the back of your throat. That's horrific. Vile. And then it pushes out your nose when you can finally breathe properly. You wake up. And then obviously it comes out. And they have to pull it fully out. And that is disgusting. Oh, they are vile. And the ones down your throat are vile too, but yeah. But the ones down your nose are worse, I think. Things down your nose, obviously, yes, I have tubes down my nose, but they're, literally, they're kind of a given because I have to have them, but an airway is when it's needed, but, to wake up with it there, wild, literally, this massive thing that's got, I've actually seen them they've got, a ring around them, they're like rubber, and they've got literally a massive hole down the middle. There's a whole airway that goes from the back of your nose all the way down, open to your esophagus.
Yeah.
It's so strange. Vile things. And I've had one in both nostrils. No, I can't. I just think. I reflect back and think, what the hell did I look like going into A&E? What did all these people think? Do you get what I mean? They must see it all the time, but I think, fuck my life.
But she has a fast pass, so how will people see her? She's in a cubicle and out in no time.
Oh, little gem. I'm okay, sweet. How are you? Oh, yeah. It's awful. I can't even. And the mess I wake up in, like my hair. Not that I care about my hair at that point, but everything that happens with an epileptic seizure. You know what I mean.
Caroline CPR, are you still wanting to come in the box?
Everything that happens with seizures as well. It's just horrendous, honestly. Other people live that are hating on me, that's fine, lovely, I don't care.
I'll let you in now.
Hello.
Yeah, frankly. Sorry, I don't.
I literally just want to say one thing.
Yeah.
She was listening to me the other day when I explained that I had 2 nasal airways in my nose because she's just repeated it.
I can't tell you what triggers them. It's my brain. My brain just,
Never mentioned it before.
Sorry?
She's never mentioned it before, so she literally just listened. Yeah, and then repeated what you said, pretty much.
Does.
I said it in a live that I had 2 nasal ones and 1 mouth one before I ended up in ICU. And she's never said it before till today, so she's been watching that live.
Yeah, triggers.
That's why I'm really angry. I thought you've got no bloody clue what it's like waking up in ICU with the fucking thing down your throat.
When I'm in a lot of pain, I'm less tolerant. My tolerance. Oh, I don't know, lovely. That's nothing to do with me.
She's really dangerous.
No, she watches the live and she soaks that information up, right, and turns it on herself. She's never said once, right? I've just edited and uploaded that same that same video about all of this that she's talking about. Not once did she say she had a nasal airway, and now suddenly she's got two.
Shoulders then lowered, if that makes sense. So he's more
honestly
seizure if my pain
really does steal stories and just takes them on.
I'm trying to word it properly. I'm struggling. I'm getting really tired now. Yeah, it has nothing to do with it. I don't understand it, love. The only one that I know about is the farm, Mrs. McDonald's funny farm. But yeah, if my temp spikes, that triggers seizures too. Like, if I overheat, it tends to trigger a seizure, actually. You're right there. But, like, it's like, even, like, if I feel very cold, are they? Everyone's seizures are completely different, lovely, quite frankly. Even if I feel very cold, I can still be very hot, if that makes sense. And that can trigger a seizure too. Yeah, and not everyone's seizures are the same at all, lovely. I have epileptic and non-epileptic. And there's lots of different types of seizures.
Oh, needing a tool. Got the Caroline's coming in.
Is it coming?
Oh yeah. Oh yeah. Oh yeah.
I don't think she was.
Made a bit of a, I don't know, maybe. Only a minimal increase, thank God, because I don't want too much increase at all, but I don't really want my meds touching, like, not up. I like them down, but yeah. What? Oh gosh. What do I do now? I'm not even sure, darling. Yeah, literally, that's what it's for. Just jinx myself, fuck's sake. He falls to the floor. They're called drop seizures, lovely, normally.
Drop me from the box. I just wanted to say that. I just got really angry.
No, that's fine. Honestly, if you want to come back in, just let me know.
I literally got really angry. I was like, I've got to say something because she just nicked my own story.
She's honestly so deep.
Drop seizures.
I've got an idea.
That's just a different type of seizure.
We need to kind of make up some like medical term.
Yeah. I'm really shocked because she hasn't got a clue what it's like to wake up in ICU. Thank God I wasn't aware that I had the nasal tubes or the mouth one. I think it's called an OPA. I wasn't aware because I was really unwell.
But then if I did, I'd just
But the fact that she stole my story. What a cow.
But not in a seizure, if that makes sense.
Yeah. Drop me, please.
Okie doke. Let me know if you want to come back in.
Thank you. Bye.
Yeah, I have epilepsy too, lovely. I'm saying that's a type of seizure. Epileptic seizures, there's still many types of seizure within epilepsy. That is a drop seizure. That it can still be epileptic, but it's, yeah, a drop seizure is a type of seizure. Epilepsy isn't a type of seizure, it's what causes the seizure. It's the diagnosis. But the type of seizure is different, yeah. So how they present is what type of seizure it could be, or is. But yeah, you normally get told what type of seizure.
Max assuming that she stole the story.
I'm just doing my medication.
You know what I mean?
Hey, lovely. I'm just doing all my evening medication, but yeah. Yeah, exactly. That's what I'm trying to say. Hi, Jamie, love. How are you doing? As okay as I can be, thank you. So minor epileptic too.
We're as okay as I can be, Caroline. She is. She's just been summoned.
Okay. Evening meds. Evening, it's nearly.
Yeah, she's live now.
I class evening from about 4 o'clock onwards. Bed is night time, but yeah.
No shit, Sherlock. Fucking hell, she's a clever little one, isn't she?
I can't eat by mouth, but I can drink. I will occasionally. So anything I have orally, I can't retain in my system anyway. So I will either vomit it out or it drains out, which is why I've got the NG. Yes, Jess.
Yeah, she's live now, Tanya.
So this goes straight into my intestines. So everything I have goes straight into my intestines. And everything that goes in my stomach doesn't stay there. My stomach doesn't work. So yeah. Gastroparesis.
Her account name's not going to be given.
Nightmare, sweet.
Just an FYI to people, we're not going to actually say what the account name is on this live.
Well, 46 Lane Shores. You can't have that sort of thing down an NJ tube, lovely. You can't push feed through an NJ. It has to be done via a pump. And I can't drink 46 Lane Shores because literally they wouldn't give me any nourishment anyway. So I'm not on them at all. I'm on Vital 1.5, which is my feed. It goes through my tube, through the pump.
This is never out of touch. Through the phone, you little liar.
I always forget this one. BRB, just log in it.
What's she BRBing for?
She's probably just been told that she's been streamed. She does this.
Sorry, my throat's going like hers.
She's like, oh, that's yes, it. Oh.
Jeez Louise, jeez Louise. I'm obsessed with this gingerbread man. I feel like I'm stealing it from you, but it's class. I've got people looking at me through the door thinking, what the fuck's she doing? I bet you.
Oh, Mrs. McDonald, how are you, lovely?
Oh, what's Violet saying? Who's Violet?
You were coming. No, lovely. It doesn't work like that. I don't just get to eat when I want to eat. Like, it doesn't work like that. My stomach doesn't work, love. I'm advised not to eat. If I wanted to have something, I'm advised not to, basically. But yeah. So my nutritionist.
He's rude to people, so what she's doing before.
Not to
He's
eat.
doing
Clear fluids. Well, I can drink any clear fluids or any.
why can't I talk?
Say, but yeah. An
A Libra. She's doing a Libra on the back of her arm before, and someone went, "Oh, I heard that click." She was like, "I've been doing this for a long time. I did hear it click."
And then the
They
J.
weren't even going on about the Libra, they were going on about a shoulder.
I do have an SPC, yes. Yeah, literally. Hello, Mad Night King.
She won't agree to having Munchausen's.
Last little flush.
Kelly, the question is, you've asked, can I ask what she's claiming to have? You should be asking what she's claiming not to have.
It's okay, sweetie, don't worry. Just drinking any drinks affect it. I'm allowed caffeine. The caffeine doesn't absorb in me at all, lovely, but yeah.
Yeah, 5 o'clock this morning, quite frankly, she did go,
Absorb in me, it either drains out or I'll stick it out regardless, and it doesn't actually absorb in my stomach, so yeah.
Chat shit.
So I can drink pretty much whatever I like, as long as it's not. I tried to stay away from too milky things, like really milky, like I used to be so stupid and drink like a milkshake, for instance.
Oh,
I do that now because
you had white milk coming out of her tube the other day and said it was a really milky coffee. Oh, no, sorry, tea. She's a liar.
No, but she'll go on saying that stuff drains out straight away, so she'll drink a bit of a Monster and then watch it come out of a tube.
I've got bladder
But then when it comes to the milk stuff,
for
the milk will take about 4 hours to come out.
had a
Does that make sense?
the SPC for 7, because obviously I have the other one.
Yeah, just the milk coming out of the tube, nothing else.
Who's that? Oh, I need to go, guys. My carer's here. Sorry, guys, need to go.
Oh, 5 o'clock cup of tea. 5 o'clock cup of tea. That's what it is. Sip, sip. Chug, chug.
Did she pull that kind of face like shit? I shouldn't have these tubes in. Kind of face. Did you see? She pulled them when she did a carers were there.
Probably.
It's like shit. That was a shit face. Like shit. Who lies so much? Are you on about me or eh?
I would love to be a fly. Well, not really, but like I would love to be kind of a fly on the wall when her carers come in.
Well, someone commented on a picture before. 1 minute, I'll be back. I need to see what the comment said. I did screenshot it. 1 minute.
Okay.
Hello.
It said, I'm a neighbour, the bitch eats everything. I seen her walk into the car in the garden. That's what it says.
Stop it.
It does. It says, I'm a neighbour, the bitch eats everything. I seen her walk into the garden to the garden.
Stop it.
I've got the screenshots.
Oh, let's see.
1 minute then.
Please show. Stop. Caroline, which one of the Carolines just asked if they can join? Yeah, you can. There's too many. Oh, Sweet Cyclizine, I've only just seen that one. That's class. Oh, why am I big? Hold on. You can go big. I like being the little one. She's everything.
Yeah, what on earth?
Oh my god, please tell me that's not someone just making it up.
No way.
Oh my god, that can't be someone just making it up, surely.
Maybe have a look and see how many followers they've got, or if it's just a new account.
Ah.
I was just coming on to say, because she knows like everything's in question. You'd think when her carers come, she'd stay live and be like, "Oh, say hello. These are my followers."
Yeah. No, people are clicking on, and she knows that the carers have probably got to come in and go, "Would you like something to eat?" Like the one was captured before.
Yeah.
And she's scared what they're going to say on live. Is this a new company? I remember her mentioning that she had like a new company or something, different to her previous ones.
Yeah, I think so. But then she said the other day that the company that she's with, they're more like for like lonely people. Because she was saying that it was on my live that she was the youngest one there, because all of them were old people, which carers mostly like. It was for that's why she said she has companionship care. That's the one. So it was like because she wants a friend. I think it's just people going round pretending to be a friend for a couple of hours a day and going home.
So they're not even carers that have got like any medical training at all. It's literally just companionship.
I don't know, because she did say it was companionship carers. And it's when we were camptooning her on mine, she said it. Because everyone were laughing because she said she was the youngest client.
Yeah, if it was companionship, then they wouldn't have the domiciliary care, meaning they haven't got the medical training.
Did everyone remember when she said, did everyone remember hearing her say that were in my life? No, she's definitely not end of life. She will never end of life.
No. I agree with what Drew said. Like, Drew said, I wonder if she got kicked out of her old company for putting them on camera. More than likely.
Meals on wheels.
What did she say? Meal on IV pole wheels or something like that. We'll just have a cup of tea with the person they can't help with them. And she does say she has a 5 o'clock cup of tea.
Companion carers there to just have a cup of tea. Yeah, that's what I'm saying. They wouldn't have any of her medical training. Because it's completely
You
different.
can kind of shrink me back down now, you know. I don't need to be the big one anymore.
We like the angry gingerbread man.
I don't want to be the big one.
Yes. Don't be the big one.
Your facial expressions make him look angry, though. It's funny. See?
See? And mine looks dead happy.
It just proves that I've got a resting bitch face, to be honest.
Everyone's partial to a resting bitch face. Love it.
You mean like that weren't, no.
That's a given set.
Yeah, it definitely weren't that up in us.
No, but they hadn't seen this thing up her nose. She said this has got knotted inside her and we couldn't work out what the tube was because it didn't look right.
That tube was just wow. I think it's an animal tube because I had done my research and it came up with that exact tube, but I can't obviously say if she's got from that website or not. It begins with Z.
Yeah.
It's an animal website.
Someone said to her as well this morning, oh, well, you buy all your stuff and you get people to send you it. No, I don't. Well, we've seen the proof.
Yeah, it's got no tubes in. Her tubes are out.
Yeah.
Also, they're different glasses.
No, they're the same glasses.
I swear they're not black. Are they black? Am I that stupid that I'm completely oblivious?
No, they look black to me as well, to be fair.
And isn't her glasses blue?
No.
They're the same as mine, so they're like bits purple, bits and pink. It's like a marble sort of effect.
I'm going to go on the screen recording that I've just done. I know they are the same glasses. They're like a brownish colour, maybe.
But what gets me right, she's constantly fiddling with her nose. And my ex-husband, I found out he's a raging coke addict. And he could not stop touching his nose and sniffing.
Say Coca-Cola. Say Coca-Cola.
Coca-Cola, yeah.
She's had many tubes of people off the Fowler Syndrome Facebook group.
See, what I don't get with this one as well, if she's in hospital waiting for an NJ tube change, one, where's the drainage? And two, why did they take, because obviously the drainage were on the side where her hand were on before she went to hospital 9 hours ago. So why have they took the drainage tube out to put the tube in the other side, to put the drainage tube in the other?
Exactly.
Yeah, but she was asked point blank this morning, oh, well, have you been to hospital the past day? And she went, no. But that tube was on the other side. That's what it was last night. And I was just like,
Yeah, so Lady Perkle in comments, she's one of my mates, and she's just put, people who lie touch their nose often. The hair rub is to self-comfort and measure herself.
Yeah. Have you ever seen that programme called Faking It?
yeah.
And they talk about the body language and stuff. It's really interesting to pick up what she does, the exact same thing.
Yeah. But like every day you can see that she's been Googling new things because every day she's got a new diagnosis.
or she watches the live because she took my story of having two nasal airways and a mouth before I ended up in ICU. I said that on the live a few days ago, and suddenly she had to.
Yeah, well, I mentioned about having home call for like medical emergencies because I've got home call.
Yeah,
And he wasn't suitable for her.
nothing will be suitable other than the ground, possibly. Soon she's going to come live and she's going to be 6 foot under going, "Hi, I'm died." And we're like,
Was it?
wow.
Yeah, one of the latest ones is to go with her EDS. She now thinks she's got rheumatoid arthritis because her fingers are chubby.
Oh no, she stated that she's got a diagnosis and then she hasn't got a diagnosis. Then she's got child arthritis. Then she hasn't. I've lost track.
She was saying she had juvenile arthritis, which is when you get diagnosed with it as a young one. But then I've got a capture of her saying after it, like literally, she's not diagnosed, it was suspected. That's what she said.
Yeah, well, that's what she said with the EDS. They said it isn't EDS, but they said it to me, so I'm saying it's EDS. I'm like, she never forgets. Well, she never remembers what she says at all.
Doesn't. Hence why her old account got taken down, so we didn't have anything to kind of, what do you call it, fact check.
But like, at someone of her age, though, you think 25, like, you should be going out and living your life and enjoying yourself.
I think she knows how babies are made either.
Does she not?
I don't think so.
Oh, no, because it'll be a
conversation
next.
Danielle had one evening. I mean, I was wetting myself screen recording. It made my week. And they were talking about toys, you know.
Yeah.
And I tell you now, she was so angry that there was steam coming out of her ears, right? And she looked so uncomfortable. She didn't know what to say. She couldn't even talk in the conversation because she didn't know what to say.
Oh my God.
Yeah. Kirsty, have you just seen the video? Is she still in it?
No, she is in comments.
Oh. I'll see if she's seen the video on the chat.
Yeah. Right, see you later.
Video from her own account stating that she was paralysed in the September of 22. She said in Emily's live that she was paralysed in April 2022.
Oh my God.
She slipped up there, isn't she?
This is the thing. If you're gonna lie, at least make it believable.
And didn't she say also that it was because of brain damage?
She's saying that at the moment, but she's also said that she had tumours. She's also said she was in an accident. She also
said it was because of FND.
Yeah. What else is it? Oh, the list is so long on why she's paralysed that I've lost track.
Like, you can see why, like, the way she talks about her mum compared to her dad. Because I don't think her mum puts up with all the bull.
No. She doesn't, you can tell.
And, like, for a parent who's lost a child to cancer, and to have another child that's in all this.
In a comment from Kirsty May saying she was caught by a nurse in hospital drawing red paint, I'm going to say, just in case we get bananaed for that word, from her cannula and pushing through the port on her catheter. The catheter is real, but so what, she's playing with her cannula.
It's like she said as well that the hospital were giving her scissors. With someone who's got mental health problems, they wouldn't do that.
Oh, I don't know about that. Someone that I know recently just been in the hospital and they gave her a pair of scissors and she cut her own hair off.
Mine and your eyes went exactly the same then.
Maybe big thing that. She literally psychotic and went in the bathroom with a pair of scissors and cut all her hair off in a psych ward.
Make me big screen a minute.
Absolutely shocking. So yeah, it can happen, but she wasn't. She was in general hospital.
Can someone tell me, like, she looks really pleased with herself at the fact that she's got all these medical devices hanging out of her? Like, why
Yeah.
has she got to show them? Why does she look so happy in this picture?
And she's wearing the skinny jeans that she said you can't wear.
She's not wearing skinny jeans, she's wearing a skirt.
Oh no, there's another one where she's wearing skinny jeans I've seen.
She looks well pleased, doesn't she?
Yeah.
Where is she going?
This is
Probably
an
to
old
the
video, it's not a new one.
Yeah, but still.
Like, and it's just the fact that how pleased she looks.
Do you think
This
she
is
goes
funny.
out clubbing?
Maybe she's got an
You might.
only F account, you know, only fakes.
Yeah.
She was going on about Plenty of Fish the other day. I was like, how would you know about that?
Definitely think she goes out clubbing when she's not on live.
Oh, yeah.
Yeah.
She
Like
does.
tubes out, wheelchair away.
I bet she wears a wig as well to try and hide it.
Tubes out, wheelchair away, legs out, let's go.
She's living a double
Night
life.
out in Norfolk.
But like, if she was ill as what she says she is, there's no way her mum and dad would go away on holiday and leave her.
I was thinking that the other day when I heard that they left her. I was like, they wouldn't do that.
They put her in respite. Like some sort of respite or...
Yeah.
Because I do, obviously, do care for people, but the parents would always make sure that they're in respite, but most of the time they don't live alone anyway.
But like with her supposed conditions, she would have an overnight carer.
Oh, 100%. 100%.
She wouldn't be living on her own, she'd be in assisted living.
Yeah.
And like you can see when her dad comes around now, her dad's starting to get really peeved.
Yeah, because he come in the other night and just completely shut the live off without saying anything.
Well, yeah, well, she's getting him up at 3 o'clock in the morning for a fake emergency when he's got to go to work, the poor man.
She literally, I've got it in the video actually. I think I posted it. She goes, "Oh, I passed out."
Yeah.
And he just walks in and just turns it off.
But now,
I'm back.
now knowing what time her mum goes to work, she waits for her mum to go to work, have an emergency to call her dad, so mum doesn't know.
No, she just doesn't want to get involved. I don't blame her.
But is her dad enjoying all his attention?
Yeah, he's involved. Fully involved, actually. Yeah, fully involved.
Who's going to help her shit when they're on holiday, someone said?
I posted Emily's live when Dad came in on Reddit. On Reddit, I've posted 6 parts, because Reddit are difficult. 6 parts of the whole interaction with Dad on Emily's live last night. It's on Reddit.
Hey, God. I mean, like, she's giving out medical advice to people left, right and centre. I've heard that she's had a mod who was only 17 before.
I've heard younger before.
Oh, Jesus.
I heard she had a 15-year-old once.
But mods are not part of the care package or able to cope with emergency. They're not even there.
Someone else has heard 14.
Although Caroline's CPR is very good at over-the-phone CPR.
Oh, I know, it's brilliant. And Caroline's air ambulance as well gets there in no time, even in the dark.
Yeah, because if I need Debbie in person, Caroline's air ambulance picks me up.
Yep.
Although I am retiring.
I seen Caroline's CPR work myself yesterday.
Yeah. I
And
think
3 people she brought back.
I am retiring though, so if anyone needs me, I'm sorry, I've retired.
I know, but Caroline, your CPR on her is amazing because she doesn't even stay in hospital. She's home within 10 minutes. It's brilliant.
You can't leave us Caroline's CPR.
No, I'm retiring. I'm no longer part of the Caroline crew. Not after today. I'm retiring.
Oh no.
No, I could come back as a monster can CPR, but I don't know if that could give CPR, to be honest.
And you got to wait like another 20 plus days to change it.
No, mine's only 7 days. I didn't change.
Mine's 7 days as well.
Mine should be 5 now. 5 or 6.
But she knows, every time she goes on live, she knows that we're on.
Yeah.
And she's watching us, and it's really getting to her now.
I don't. He's getting to her, but she's also loving it.
Caroline air ambulance today as I went to see. Oh, air ambulance is fucking class.
Air ambulance in here.
No, my mate said, her hubby said earlier that he should call Caroline Air Ambulance because she went dizzy.
Oh, did he turn up?
I love it.
Did he turn up though? He's quite good. He's quite quick. I love this old Caroline thing, to be honest, but I mean, someone's ruined it now.
First thing, I only went down this rabbit hole a few days ago,
Oh,
and
did
within the first couple of posts I'd seen, I thought, this girl.
A couple of days ago.
Yeah, a couple of days ago. That's all it took. Because of my own situation, I like call you out on that one, call you out on that one. Then I did the Google search, and I thought, oh my god.
Yeah, you do end up
Wow.
down a rabbit hole and you can't dig yourself out. Like well, I knew she was fake from day one. Years ago, I was watching her on here, and I was just flicking through, and I knew straight away she was faking it. But I
Person
guess,
I was in hospital with her and she can walk.
yeah,
We know.
The amount of times we've seen her like sit down on live and push up with her legs to like scoot your bum forward on a chair.
or
One-handed
kneel.
transfer as well.
Oh yeah, and a transfer without a banana board as well. Oh, risk taker.
Magical.
Oh, and the one I seen earlier where she like went to go and stand up on the footplate of her wheelchair, and then she looked at the live as if, oh shit, I've just done that on live.
Yeah, for someone who's paralysed from the waist down, you wouldn't be able to bend forward and bend down to the ground to pick something up. You'd tip over.
Yeah.
The way she hangs off that bed half the time.
I know I'd fall out, and I'm not even paralysed.
Oh, I've just pulled myself up the bed. I shouldn't do that. Your backside will be wobbling all over the place.
Does she think?
Someone she said then as well, like the muscles in her legs it just, don't make sense.
Oh, and I seen another one. She said that she'd been in hospital for 8 months of, was it 8 weeks or 8 months intensive PT while she was in.
She poos out of her mouth. That's what I'm going to say.
Whilst her dad pulls it out.
And then she was supposed to get out, but she had to stay in for another day to see a dietitian.
Who said that?
Miss KiKi herself said.
Oh, I thought you said she was in the comments. I was like, yeah, right.
No.
Not that silly after last night. This is
I
how
won't be surprised, you know, if she gets a fake account though to try and get in.
She can I will happily have her in the box.
Well, that's it, because we speak facts. What she does is bully.
Yeah.
Yeah.
She probably poos into
When she
the
spoke to someone like rubbish today, I've got it on screen record. Someone mentioned about a shoulder clicking, but she thought the person was going on about the Libra clicking, and she was like, I've done this enough times to know when it clicks. I heard it click. Like, really rude.
Hold on a minute. I thought she was paralysed in the shoulders and her arms.
Yeah. No, someone asked her when did I last see her? It was literally just after the video that I captured of her saying it. And
Someone said that they want to hop in the box and show a seizure video. The only issue with that, it could be really triggering. Like, if you show her having a fakey shake, it could be quite triggering for people watching. I'm just, that's the only thing I'm saying is that it could be quite triggering.
yeah,
It's fake, and it looks fake. I mean, it's hilarious, but
Yeah, well, she said when she has her seizures, she is not there. She's vacant, so she doesn't know what she does or what's going on. But really, you're looking at the comments every 2 seconds.
Miss K has just said, I don't want to show, I just want to talk.
oh, there you go. Yeah, you can drop me down. I'm doing editing, so
you can stay in, I think.
that's
there's
all right. You can
nothing.
drop me.
Hello?
Hiya.
Hiya, can you hear it?
Hiya.
Hiya, can you hear it?
Yeah.
Listen, I have epilepsy, I have grand mal and tonic chronic seizures. And people in the comments on that seizure video before what just come up on my FYP, see the baseball bat basically is what happened to me, and it's through a head injury. Now I've seen her sit there and lie our way through all her lives that she's done and all these pretend seizures that she's had. She's off her nut on morphine every single second of that day. Morphine and diazepam. There's no way she's going to have that amount of seizures with how much diazepam she takes.
How is she getting diazepam and morphine together?
Well, she's supposedly on four tablets of diazepam, 10 milligrams, twice a day. So that's 8 tablets. So 80 milligrams of diazepam. Never heard of that amount ever in my life being prescribed.
No.
In the morphine, she's getting, do you want to see the bottles? The them 1,000ml bottles, you know, the big bottles. It's them what you get.
I genuinely have seen one of the bottles. It is big. I remember when she cracked one and she got her dad to try and put it in another container or something.
Listen, I've got a little bottle here, right? I've got a tiny little bottle here, and trust me, hers is 10 times the size of what mine is.
Right, I'll tell you what size mine is, and this is all they will out because of
1 minute, I'm
the
going to get mine
addiction.
out as well. 1 minute.
Mine is a 300ml, and they'll only give me one of them.
Mine's only 100ml. So mine's 10 times the size of what hers is. But see, morphine and stuff can trigger seizures, so she would not be on that if it's like at that dose. If it did, if it was from like if she was given that amount of morphine, it would trigger seizures completely. But with the diazepam, that dose of diazepam, trust me, she wouldn't.
So Drew said, let's just do a bit of fact checking. Drew says that she gets the big ones as well.
1,000ml?
Not put what it is. She just said she gets the big ones. So I wonder if again that depends on the area. I don't know.
But if she's on 1,000ml, say that's a week's dose, right?
Mm-hmm.
That's still over the guidelines for when you've got epilepsy. You should not be given morphine, tramadol, anything of that state whilst having epilepsy like the way she portrays to have. Bearing in mind, I have probably 4 seizures in a good week.
She was asking on a live the other day for people if they could send a rectal diazepam.
See, that's a I cannot remember what the word is. It's a medication what somebody can give you up on basically whilst you're seizing, and it can bring you out of it. But obviously,
according to where no medications work on our seizures.
Are you on about the rescue meds, Miss Kay?
Yeah, the rescue meds. Sorry, I couldn't think of it.
Buckle
Exactly, benzos and opiates cause seizures.
I was just about to say TikTok shop.
Yeah, it's up. Listen, her full life is just one big lie, through and through, for sympathy, whatever it is. It's a downright lie. Everything she has. Listen, I went on and I said what I had the next day. She had it. I was saying what?
Yeah,
yeah.
She shouldn't be allowed. She shouldn't be allowed to show all these medications on alive or.
Pushing I think it's cyclizine, the anti-sick, intravenously, you get a double effect. Is she lying about the seizures? 100,000,000%. I put my life on it.
Yeah,
them are just normal seizures.
Yeah, well, I saw her taking medication every 2 hours before.
If you notice, she does the diazepam in a cup. She dissolves it and sucks it up in the tube. How she abuses cyclizine, exactly. Because cyclizine gives you a hit, doesn't it?
But most of the time when she's putting it into the tube, you can see it draining straight out as well.
Mine are 1,000 mils, as I could have up to 10 milligrams a day every 4 hours. But never actually take that much.
Never take that much.
But she should not be on that at all if she has seizures. She should not be on that.
And then the other day she said on a live that she has a carer come out at 1 a.m. to do meds.
1 a.m. to do meds?
What?
Do them myself?
Yeah.
No, she says she has it at 10 for 2 hours.
She said the other night on live, she's got a carer coming out at 1 a.m. to do meds. but she does the
I
meds
thought she
herself.
could do meds.
I was going to say, didn't she do her own meds?
Yeah, and no carer comes out at 1 a.m.
Listen, I'll say this, because I live on my own. I have something called a PA, and them come in and they just basically monitor you while you're having bath times and stuff, supervise you during bath time and while you're cooking and stuff like that.
Well, that's the other thing. She says that she can't shower, but if she was actually, as she says, the council would have put in a wet room for her, and she would have a hoist.
See, I'm waiting on a wet room. And that's why I'm supervised during bath time. So until that happens, like somebody, like strangers and that, have to watch you. You know what I mean? It's embarrassing, but it's got to be.
Yeah. Well, I've had them wash me and wash my hair before because I couldn't use my arms.
Well, I had a seizure in the bath and I was basically found floating from my partner. So now after that, when obviously the hospital and stuff were like, no, we're not happy with that. It might be her, it might not be her prescription list.
Yeah.
Might not be hers. But yeah, she's definitely getting stuff off people. 100% she's getting stuff off others.
I've had quite a few people message me and say that they have provided said person with stuff. The only reason why they won't send evidence is obviously because they want to keep themselves.
Yeah,
well, yeah, because basically that's classed as dealing, isn't it? So
can I just correct you? Midazolam is not a rescue medication for epilepsy. Midazolam puts you to sleep. It puts you to sleep. That's what they use in theatre. Midazolam to put you to sleep. It's not an anti-rescue med for epilepsy. It's usually diazepam, or I haven't got a rescue medication now because I can't give it to myself, obviously, but the suppositories.
My boy's got rescue meds and he's on Buccal midazolam.
He's on midazolam?
Yeah, Buccal it's called. Buccal
Is it proper midazolam though? Or is it mixed with other things?
It's called... because it comes in a syringe and it's called...
Right, you know what I mean? You've got somebody to give you it. But me, on the other hand, I don't.
It's going to get to the stage where she really does need medical help, and because of all this, no one will come.
Well, people are saying like something's obviously got to be happening because eyes are rolling, but you...
Buccal, but then underneath it says Buccal midazolam.
Yeah, well, see, I've never known. Obviously, like I say, I can't speak for others. I can speak for me, but I've never ever heard of midazolam being used for it. So that is.
But she's got sleep deprivation as well, though, because she's staying up all day sometimes and all night.
How can she have sleep deprivation?
Because she's on live 24/7.
Milligrams of diazepam. Now I noticed as well when she was putting that diazepam out, they haven't got no name and address. You know how you can usually see the bottom sticker. So
yeah,
the box the upside down. It's got no sticker.
I've not seen any stickers on any of her stuff.
Nah.
She, like I said, she was putting a Libra on before, and I tried to see the prescription tab.
Yeah.
Couldn't see it.
Nah, the black marker things there, while she's getting them off somebody and they're taking the stickers off.
Has anybody actually heard of diabetes type 3?
Please don't remind me when I'm right. I work with epileptic.
The only time I've ever heard of it was through her. However, I have seen
and then
people
last night
say
she said she's not diabetic.
Well, didn't you say it's type C or something and then it's type 3 now?
But last night she said she's not. And she's never said she's diabetic.
Type 3C is an actual diabetic, what's the word? Diagnosis. Like, people do have it. But in said person's case, she said she had it, and then doesn't have it, and then all of a sudden it was a misdiagnosis.
Like everything else.
No.
It's just one thing after another, isn't it, with her?
It is a real thing. It just in her case it was and it wasn't.
Yeah. Yeah, and whoever that was, like Gabs or whatever, like I've just said, I do apologise. I haven't been informed on rescue medication because I can't give it to myself. I used to get the suppositories of diazepam, you can't give it to yourself. no one can give you them unless, obviously, while it's just me, I can't give them to myself. But my partner could. But yeah, that's just not something. But I did apologise, Gabs, if you had listened.
No, you're fine. You're fine.
Just had a little attitude problem, but anyways, I'm not here to argue. I'm just to tell you about her. What you see on that is anybody that suffers with epilepsy or has people around with her that's epileptic, you'll see that's not a normal seizure. In the noises, in the talking and stuff between on that video, saying I'm confused and then she goes straight back into another one, a brain wouldn't have recovered quick enough before it went into another one. It's impossible.
There's videos where she's
my
like,
granddaughter
I don't
has
know what's
them.
happening, where am I? But then she's looking at her phone knowing she's on TikTok. You've just said you don't know what's happening.
I've had a few of mine on TikTok, but my phone has never ever been still propped up, ever.
No.
Like,
And it's funny, they only happen on live as well.
That's me, just as for Caroline, I can't speak after me seizures, but I mine are full epileptic. I can't verbalise, so it's usually a squeeze of the hand or a tap the arm. That's all I can really do to respond. Like if people ask me, "Are you all right?" and I'm like tapping and squeezing. But as for anything else, no, I don't ever know I'm on live until my mod rings us, and then I still can't even speak to her. But she's like, "You're on live." Do you know what I mean? I just press whatever on the phone. But
whereas she talks to her mods when she's having a...
When she's having one.
Yeah, like it's to go into a cluster seizure and speak between them. If you listen to the last seizure that she has, she's talking through it. She's still saying words.
So the mod saying, "Oh, should we get Dad?" Yeah, get Dad.
Yeah.
Claire, there is a type of 3C. Do you know there is 3C diabetes? But this is why obviously we do these lives.
Does anyone know if she actually wets herself during these seizures? Does she have to be changing stuff afterwards?
That I don't know. I've never heard, so I can't.
Well, she's got a catheter, hasn't she? So.
Oh. Well, I don't know. I just don't. She doesn't chew her tongue. She never complains of a sore tongue or nothing. Like it's just all a bit weird for me.
She never has any sores around her mouth either, because like my granddaughter bites her lips when she's having a seizure because you've got no control.
Exactly.
My body does, yeah.
Type 3 is medically induced diabetes. Did somebody just post in the comments?
I was going to say that you lose bowel. Yeah, every time my boy has a seizure, he'll have a dirty nappy after.
I always wet myself. I don't know. I've never had it the other way. I always wet myself. I usually cry about it myself, to be fair.
Well, she has her dad come out and evacuate her.
Evacuates it, yeah.
Yeah. Which is a bit
Hey, you
weird.
noticed she went into one, then noticed he wasn't there. She then went into a second, still noticed he wasn't there, and then she went into the third after talking throughout it. It baffles me. I just don't know. Why would you want to lie about these things? Like, these are horrible things to live with.
Do you think that because she saw her sister the way she was with the cancer at a young age and saw the attention and
100%, she's craving the attention of. Well, if you notice, her ma doesn't even pay attention. Her ma's got no interest in playing the game with her. As for her dad, though, oh god, yeah, dad runs. Dad jumps. But as for the mother, if you notice, she'll turn to pause the phone and that when her mother's there.
Her dad started to not interact though when he arrives.
Oh, has he? See, I haven't been on our lives for, I don't know, a couple of weeks maybe?
The latest one I captured, he turned up, he didn't even say anything. You just literally seen a finger as he tried to turn the camera, and then...
You know what I laugh about? When I'm about to say to people, can you respectfully leave, please, while she has a medical episode?
Good morning. I'm back.
It's weird because she does have a medical condition, but it's just not the things that she says.
She's got Munchausen's.
Yeah.
But anyways, I'm going to hop down. That was just my thoughts and opinions. Once again, I'm sorry if I offended anybody in the chat.
No, like, don't apologise. This is why we do it. One, obviously, it's to raise awareness of said person, but it also helps other people. Like, I'm not...
Guys, I'm
I
going to
don't
have to hop
understand
down because my
everything.
foot and my door's going all right.
Okie doke.
Thanks, guys.
See you later.
Bye.
Bye.
Right.
Kirsty's back now. Gotta be good.
I'm a Kirsty too.
What have you found out,
Oh, God,
Kirsty?
we've got two Kirsties.
Come on, Kirsty, let us know.
Oh, dear.
But I think Kirsten attacking little kids, though, that is just... That is something completely different in itself. That is just not normal.
Well, me and Kirsty were saying yesterday, like, obviously she's gone for Kirsty's little girl.
What are you talking about me for?
Are your ears burning, Kirst?
Why are you bullying me?
Yeah, obviously she's gone for Carly. I messaged Kirsty the other day saying a comment was made about Brooklyn as well. That's 2 kids who've got the same disability. She's gone for other kids as well as that. She's fucking sick. Like, if you want to pretend you're ill, pretend you're fucking ill. Don't.
Yeah, you don't. No, you don't. That's just wrong. Well, everything she does is wrong, but that is just on another level completely.
But like me and Kirsty said, she's probably jealous that these sick kids are actually sick. Like, they're actually genuinely sick, whereas she's having to fake it.
No, but that's the thing, because unfortunately there are people out there, you know, that are in this world that are really unwell.
Yeah.
And because they're more unwell than her, she doesn't like it.
And then that's when she'll attack them.
Exactly. And that's when people go into a live that have knowledge on said subjects, they get banned.
It's like the night before last, you said, "Oh, I'm getting pneumonia. I've got cellulitis." Then last night, no mention of that. She was bright and breezy until this morning.
Until this morning, what did she say before? Oh, she had cold or flu.
Pneumonia, she said.
It's bizarre.
I've nearly died from pneumonia, and I know what you're like, and that wasn't pneumonia, nowhere near.
Honestly, my mum did, and she was that bad. If her chin touched her chest, she was in excruciating pain.
Yeah.
I know that sounds really, really bizarre, but that's what the doctors did as a test or something. Like, couldn't she put her chin to her chest, and for some reason she couldn't do it. I've never heard of that. And yeah, they were like, you need to come straight in, and she went straight in, and she had really bad pneumonia, and she had to stay in.
It's like my organs were shutting down. They said if the ambulance had been 5 minutes later, I wouldn't be here today.
Wow.
Yeah, and like that's something that stayed with me, and like I got it again for a second time, and I knew straight away from the symptoms, and luckily I got myself to the hospital pretty quick.
Yeah.
But pneumonia, it's like it's another thing you don't joke about because it's a serious thing.
Yeah.
I'm like, why? You give anything to not be ill, or not have your kids ill, and to see a girl of such a young age sit there going, "Oh, I'm dying. I'm this. I'm that. I'm not good today, but you know it's okay." Every day, 24/7, it's ridiculous. If I'm on a really bad pain flare, I'm not on my phone. I'm in bed. I'm away from everyone. I'm trying to get comfortable. I'm not online going on talking, saying this, that, the other. It's just not normal. It's infuriating. It really is.
It's like, this is just an opinion of mine. I'm not expressing facts here, but it's like she got hold of social media and she's just been taken in by it, that she's forgot how to actually live.
Yeah, which is sad.
And it is. It's really sad.
Do you know what winds me up as well is, like, obviously, as well as everything else that she's lying about, right? She's like, "Oh, I'm paralysed," and do you know what? Me and Kirsty and a lot of other parents Do you know how much we would pay to see our child be able to walk? Yes, they're not paralysed, but they can't walk. And you've got someone like that sitting in a wheelchair
Like-
pretending she can't.
I know a guy, right, who's paralysed from the waist down. He's in a wheelchair, and years ago, yeah, he can't walk or anything like that. But he would go to a wheelchair-friendly nightclub and cut up the dance floor in his wheelchair.
Yeah.
And he was out there living his life, not stuck in behind the screen going, oh, woe is me.
No, exactly.
I know. There's so many things that have been made adaptable, that have been made accessible. She really could go out and actually live a decent life, even in a wheelchair.
Yeah.
She blocks you.
Deep down, I really do hope she gets the help she needs. I know I do all this, and sometimes I make a funny video here and there, but at the end of the day, I really do hope she gets the help she needs. And I think every single one of us feel that.
Yeah.
It's just frustrating in the moment.
It's that waiting, like, is she going to take too much meds at some point and something bad really happens, and it'd be a waste of a life. Like, you know.
When I was in Kirsty's live and somebody had mentioned that she'd said on the live she didn't know whether she'd taken her epilepsy meds, so she took another dose anyway.
Oh, you can't double dose.
Be double dosed. That's the worst thing you could do. What they say is, obviously, if you think you've forgotten it, just wait until your next dose and then just carry on from there. She took a double dose of her epilepsy meds. Fucking one dose of my boy's epilepsy meds knocks him out, let alone two.
Oh my god! Sorry, I'm here. I'm listening. I'm listening to little bits of it. But do you remember the game Crash Bandicoot from when we were kids?
Yeah.
Oh yeah.
So.
Oh, Kirsty, you're lurking in the background, aren't you?
Yeah, I'm watching Crash. I'm watching. I'm not watching. I'm playing it. I love it.
Is she
I need to play it. So.
No, she's not. She fakes it, Madeline. You can tell it's fake.
It is fake. But this is the annoying thing. Like, we know she fakes it, and that's what angers me. And when she's taken the PISS out of innocent and vulnerable children and young adults, and even adults, to be fair, that's what really frustrates me, and that's when I end up losing my head over it. So I'm more to the side of, do you know what? No, you're taking this too far now, and you're bullying vulnerable people. But there is a small part of me that's like, no, I do want her to get some help.
The thing is, the way she's going, I hate to say it, but if she carries on, she's gonna unalive herself with what she's doing to herself.
Well, that's just it. I mean, she's no to all the services. Why aren't they doing something? I don't get it.
She's going to end up taking far too many meds one day, and something's going to happen.
It's because she's an adult and she's got capacity. She knows what she's doing.
She knows, yeah.
So you can't really do much when someone's got the mental capacity to understand what they're doing.
I don't know, because even though some people have capacity, they can still have a mental illness that requires them to be detained against their will.
For
treatment, which that's what should be happening.
Yeah, true.
The thing is, as well, if they haven't got like beds and shit like that to keep them, they will just fob you off.
I
think that's why her parents are trying so hard to get her the proper mental health help that she needs.
I've been through it with my partner, one of my partner's family members, and it was hell. And they didn't want to help until it got to the point where the family was put in danger, basically.
You can be sectioned if you have capacity, but that's generally if you're a danger to yourself or others.
I'm going to be open. I'm currently sectioned, so that's how I know. In terms of having capacity but still being sectioned against your will, it can still happen.
Yeah,
I think only Alex pretty much knew that. But yeah, I think I'm more obviously we've got people who are more aware of the physical side of stuff. I think I would. Yeah, I know more about the mental health side of stuff, unfortunately.
Well, she's live.
How are you doing?
Apparently,
Is she live?
Yeah, people are commenting she's live.
Is Alex in?
apparently, I know nothing. Just to let that out there, I haven't dealt with it for 4 years with a disabled child, but I know nothing.
Is that what she said?
Sorry, Kirsty, you know absolutely nothing. I'm going to have to kick you out the box right now, sorry.
I know nothing.
Oh, wow. Does she know that we're talking about it? That'll be a fun one.
Probably.
Oh, she'll find out and she'll be lurking.
Is anyone in there?
So what time is it? Hold on, what time is it now?
6:10.
6:10.
So a carer was only there for an hour.
Let me check.
Didn't you say that she was getting 2 hours for her carers now?
2 hours.
I think it's only the morning one that was...
Yeah, she said that was this morning.
It's weird that you never see her carers or parents that on live other
does
than when
she
Dad's
actually
sticking up
have
for her.
carers? That's the thing.
She does have them. I have heard people come to her door, but
Yeah, but it doesn't
she
mean the carers though.
Well, where she used to stay on live, she doesn't. Oh, thank you. Who was that put that? Emily P, not Caroline. Thank you.
I went in here live this morning, forgot I had changed my username, quickly got out of there. I know, I'm trying to find her. I can't find her at the minute. I can't get her on that account right there.
Is Alex? Oh, Alex is coming in.
Oh, there we are. Alex.
I can get rid of the big. I can get rid of the big.
Change sides whenever I go to hospital, I've been changed. But normally they are this way around.
That's not a new one, is it?
That's a new one. They're both clear.
What side they can
Is
get.
that a new one from this? From
No, that's how it looked
Can do
before.
myself, but if
Oh,
I'm
did
in
it?
bed, anyway,
Can we
they
all
tend
mute
to
the
do
boxes?
it.
Because we can hear her then.
One of my
Sometimes they, like last time, they used a bigger NJ, so it went in this side. Let me just literally. I'm just gonna change the tape, just because. Sounds itching me now. I just get a bit sore. Don't know why, but anyway, we've got the Cavalon, got the Appeal, and we got the face, well, wet wipes, whatever you want to call them. What tape we have, I'm not sure, lovely. And
just another
G. Yeah,
you,
so mine's an NG for drainage and an NJ for feeding, lovely. But so that's different. But the NJ goes all the way into my small bowel. But yeah.
Just to confirm before, she was using alcoholic wipes on the back of her arm to place her Libra, and then said, "Oh, look at it, it's gone all red, it's gone all red. I have a reaction to alcoholic wipes and stuff like that." But using alcohol gel and loads of other wipes on her skin, and I've never seen any reaction.
The jejunum, which is obviously the intestine. Hey Courtney, how are you? These tapes, these wipes obviously make the adhesive come off a lot easier, thank God. So I'm just going to tape that one before I don't want to displace it, because yeah, that's fun. Let me get my tape to one. Let's just do this one because it's out. My magic wipes, they are actually. They literally just take all the adhesive off, and then yeah. I'm going to use this pinky one. This will do nicely. The tape. Chubby Cheeks is my favourite, but yeah. Etsy are good, yeah. There's a particular shop on Etsy called Chewy Plus. I change it once or twice a day and it's getting itchy, so I'm changing it, love. I know my skin, not being funny, but yeah.
She got rude again.
I have to change it to make sure I put Cavalon on. I actually forgot. I don't know. I can't remember if I put the Cavalon on this morning, but I need to make sure I do regardless because it's a little bit itchy and a bit sore, so yeah. Message you a link. Oh, it's not to me, okay. I was gonna say, like, literally, like, yeah. Some Winnie the Pooh ones. Oh, that's, probably, I don't actually know the name. I've seen them. Yeah, I've seen them. There's loads of Winnie the Pooh ones. Lots of places do them. Chubby Cheeks do a Winnie the Pooh one, or a few Winnie the Pooh ones. They also do an Eeyore one and like different characters of Winnie the Pooh. They do a few Disney ones, but they're a bit different to the average. They're quite nice if you look at Chubby Cheeks and type in specific characters like Winnie the Pooh or Minnie Mouse or whatever. They also have an Eeyore one, which is really sweet, yeah. Stitch ones. eBay have a Stitch one, which is a bit random. It's only Stitch on a white background, but yeah. Because I don't like the white backgrounds particularly. I like the colourful backgrounds, but yeah. I like the pretty backgrounds, but the only one I've ever found of Stitch is just a white background on eBay, and that was years and years ago. I haven't been on there since, because, yeah. But Chubby Plus are on there, they've got alright ones. But Chubby Plus are on Etsy as well. It's quite a few different, well, there's actually loads of different shops that make them, to be quite honest. So many people do it as business. So and Do's another good one. Yeah, I know, darling. We're aware. Thank you there, Jess. It's going to keep happening. We don't care. Quite honestly. Yeah, this is why I have to take the tape off regularly. Nothing bad, lovely, don't worry. It's a little grim. My face gets sore, not really. No, only because the tape either goes here or here or here, but it will get like it will start vomiting. I will answer it, but if anyone's emetophobic, please can you just kind of either not listen for a minute or whatever, like, you know, like this is your warning to leave, I guess. I will answer, but if anyone's uncomfortable, please do leave or turn your volume down or something. Jess, thank you. Yeah, this Cavalon helps. A lot, darling, yeah. I do still suffer with it, unfortunately. This doesn't stop it. I mean, the NG, this one, is purposely for draining my stomach. It doesn't completely stop me vomiting. Did I ever get an orange yellow coating on myself? Yeah, that's from a lot of acid, lovely. So it's basically burnt my tongue. Thank you. Personally, that's what I got told, is it had basically burnt my tongue raw. And yeah, I did get that. It wasn't completely coated, but also But that might not be what it is for you, so I'm not necessarily saying don't seek advice, lovely. So I would still seek advice because it could have also caused some sort of thrush or some sort of like bacterial infection in your mouth. Do you get what I mean? Or something like that due to the vomit, and it might just be coloured. Yeah. It might just be coloured orange because obviously it normally would be white, but then it might have coloured just because of obviously the reoccurring vomiting. Do this because it irritate my skin. Yeah, you'd be better to ask. I mean, I vomit nearly every day, lovely, but like yeah, I was gonna say I'd always go to your GP, darling, if you're in any news about that, like any worry about things like that. Thank you. Yeah, I've tried lots of different tapes, guys. Flowers. I've tried lots of different tapes. This is Hyperfix. It's the best one for me, surprisingly. And actually, it's proven it's been the best one for me for years now. It's just sometimes my skin gets worse than other times. Can you ask what the tubes are for? This one is an NG, it drains my stomach. This one's an NJ.
No, it's not. They're both NGs, you little liar.
Is it uncomfortable? Not really, but no, thank you. But I always hang on, I've lost my train of thought. Hang on. The tubes are for, so the tubes are actually for gastroparesis. So this one drains my stomach and this one feeds me into my intestine. Goes into my intestine, I get directly fed straight into my intestine through it. So yeah. But they are down to gastroparesis, unfortunately, which is exactly what it is in the word, basically. Gastro, stomach, paresis meaning paralysis, so be complete or partial. Mine is complete now, but it used to be partial. Gets worse over time normally.
Liar.
Yeah, I was gonna say I've definitely got more used to it over time. I've had these tubes for a long time now, so yeah. And the tubes aren't particularly uncomfortable. They're not particularly comfortable. Like I'm kind of they're just there. Do you get what I mean? I don't really even notice
How
anymore.
can I tell the boss? My daughter's got both kind of feeding tubes, and I'll show her another picture after. She puts them in herself, and an NG you can't put in yourself. It's got to be done at an hospital.
You get what I mean? I know, for fuck's sake, I just want to do my makeup.
TikTok shop.
I don't normally do makeup, but like if I did, when I did have tube-free face for like a couple of years, I used to do like contouring.
The person that says you talk shit in the comment, are you talking to me or her?
Not necessarily wearing it, but applying it. I used to enjoy, like, yeah, putting it on and like doing different designs with it. So yeah. I miss having a free face. I've not had much of a free face, unfortunately, but it's what it is. Life. I'm not going to say exactly how long, because actually I don't know how many years, but I've had a surgical tube for 3 years, roughly. I've got lovely long eyelashes and mascara. I'm a bit funny about mascara. Only because
Has she
I wear
really just
glasses.
said she doesn't know how
When I
many
wear
years she's
my
had the tube
glasses, I have
for?
mascara on, I can
That
feel
is
my
a
eyelashes
total
past the
lie.
glass
She
of the
did not have a
glasses, if
surgical
that
tube
makes
ever,
sense.
never mind 3
Like, literally,
years.
they're that long when I put mascara on. I can feel them brushing the glass, so it just feels horrible. But yeah. Yeah, literally, it's horrible, isn't it? See, I just like the applying of it. Yeah.
See, and by the way, guys, she's only acting
Yeah, I
nice
have to wear
like
my
this
glasses
because
all the
she's got
time,
loads of
so I
new
don't really,
followers.
yeah.
She's trying to reel them in,
Cut
and then she'll
crease,
turn
so
into an
seeing or
astrophobia again.
mascara, seeing or mascara. I do seeing. Because if I wear the mascara, I can't do anything or be with anyone because I can't see. So do you get what I mean? Like, yeah. Same. Someone's actually
But
sleeping.
she can read comments without wearing her
Yeah, I'm
glasses.
kind of the same. I love doing my makeup, but don't actually like particularly wearing it. My eyesight's quite bad, yeah. Not really bad, but like, I'm short-sighted and long-sighted, so it's both types of vision.
Of course,
Aren't great, shall we say? So yeah.
Can you?
Yeah, my short-sightedness is worse than my long-sightedness. But yeah, so I can see better distance than I can. No, I can see worse distance than I can close up. Sorry, it gets really confusing.
Cursed, I'm just
Close
waiting
up
for the
a bit
fucking
better, so,
blinking
like, reading, I
seizures.
can just about read with my glasses off, or sometimes on my phone I can see with my glasses off.
Can read comments
If I
while
need
having a
to, but
seizure.
I can't
Eyesight
see.
must be good.
Yeah. I'm both in both eyes, but the long-sightedness has only just started within the past 9 months of not wearing them at all. I just adjusted to not wearing them because I didn't have any. So yeah, that wasn't ideal. Yeah, no worries. Oh gosh, no, it makes your eyes worse longer term, lovely. I don't recommend. Yeah. Yeah, I can't see much in the distance at all. Well, if you're telling me to read something or anything, I literally can't. Yeah, but I literally can't see anything in the distance, or read anything, or yeah, I can just about make out colours, but you get what I mean. What's the time? 6:30. What am I doing? Probably doing my last ad cow. You should wear them, darling. Hey, Becky Boo, sweetheart. How are you, darling? Yeah, stigmatism.
The
I was told it was anyway. Rugby ball shaped eyes and astigmatism, isn't it? I think. I've got astigmatism, that's all I know, but that's what I got told it was. Because I've got it too, lovely.
In the comments.
I got told that as a kid, though. Yeah.
I was just thinking it's called stigmatism, not astigmatism, because I've got one.
I just remember things from my kid. From being a kid.
My daughter's had astigmatism from birth and it's got better now. She's 19.
I didn't have
you
one when I
remember
first
something
knew
from being a
glasses, but
child,
mine's got worse.
FYI.
But then they think I've got an eye condition, but I don't know.
I'm just waiting for her to do a fucking blinking episode and say it's a seizure, because me and Kirsty were talking about it
I
yesterday.
don't remember much anymore. Jesus, my memory, I tell you. My memory is something else.
New illness uploading.
Oh God, it is quite cold, Bex. Bex, have you had your anti-sickness, sweetheart?
Visually impaired, Caroline, where are you?
You said you've got your anti-sickness, didn't you? Have you had your anti-sickness? That is all you can do, darling, yeah. You're doing good though, babe, honestly. Yeah, I can too, lovely. Gosh, thanks so much. Not really, love. I've been in bed. Well, I haven't been in bed all day, actually. I've got out and went in my living room for a bit, but I didn't sleep all of last night or all of the day, so yeah.
Hold on a minute. Sweet Caroline, bam, bam, bam. Did you say something? I didn't hear.
1 dose a day.
You're going deaf.
I am, lovely. I've got a pressure mattress, though. Well, an airflow mattress, but it's an airflow mattress with a pump that I've got, so yeah. I think that one is that other one. I'm just trying to make sure. I need to keep that one for tonight. No, you can have 3, okay. It's a bit noisy, I've got used to it, to be honest. How old am I? I'm 25. Did you? I get overgranulation on my catheter side, but yeah. That's because I've got an SPC. Overgranulated tissue is horrible. Skin tissue is horrible. And it's hard to get rid of as well, overgranulation. I've got a few illnesses, lovely. I am a 99 baby. Last night was freezing, I felt the temperature drop, literally. I've got multiple illnesses, love, but yeah. So, I'm not really going to comment exactly what I've got, because there's quite a few. Not quite a few, I wouldn't say quite a few, actually. But there's some. So yeah, I'd rather not list, because there's people on here that just judge, and I'd rather not, to be honest, lovely, sorry, but yeah. Yes, you did, Becky.
Everybody loves telling people what their illnesses are.
There's other clo. I don't know. I'm confused with both of you clothes now.
Because she's run out of new illnesses to tell her new followers, Kirst. That's what it is.
That is the face she starts making when she's still going to start getting mad.
I've had the heating on today too. It's freezing. What's going on? Well, I do know what's going on. It's changing to winter, but I'm not either. Becky, be warned. Fizzy tablets, sweet. Yeah, spring's my favourite too.
After fakey shaky is when she starts pretending to have a seizure.
So that's the second one thing. That's all of them done at least. Thank you, God. For that one. I've got the other one I still need to take. Oh God, where did I put it? I'm so confused. I'm tired. I'm so tired. I'm overtired, so I'm awake now. It's bloody annoying. I think my blood sugars might be dropping, actually. I'm not too sure. I'll have to check in a minute.
Go, are we ready, ladies?
What's she doing? I missed that.
Gonna check her blood sugars in a minute. You know how it starts.
Oh, for fuck's sake, she'll be dead on bed in a minute.
You're the first person to come back to life.
CPR Caroline, can you get Caroline Air Ambulance on the phone just in case?
Yeah,
Don't forget we can give CPR through the phone.
Answer what?
Oh shit, yeah.
That one is my.
Of course, Caroline on standby as well.
Yeah, put Air Ambulance on standby for now then.
Smells like lemon. The fizzy tablet is Adcal, but yeah.
Caroline glucose is here. We're alright, guys.
Sorry, Becky doesn't like the noise of the fizzing tablets. Nearly done. I'll move it away so I can hear it. Can't hear it now, can you? I think it's done, pretty much.
Someone with paralysed arms, you can do the thumbs up pretty well.
Must have put a lot of practice into that.
Hello, I'm back. Sorry for being away so long. What have I missed? Have I missed anything?
We reckon she's about to go because she's checking her glucose levels.
I've missed the glucose check.
And she's got new ones watching her. Got to be a shorter night. Look at her face.
Someone screenshot that.
Do the others quickly.
Damn, I missed it.
Boy.
Hey Kate, yeah, I'm as okay as I can be, thank you.
I'm as okay as I can be. Really. Alright, lovely. Yes, sweet.
Regardless.
Soldier on every day. I don't know how I do it.
What's in the crusher?
Oh, thank you, Kim, lovely, I appreciate that.
Get those greens up again. Wedges off camera.
I'm okay as can be.
Place your bets now, guys, on how long it'll fucking take her to have a fakey shaky.
Right, what time are we on? We're on 18:37. Place your bets.
In the next half an hour at least.
18:57.
I'll give it 20 minutes.
I just, yeah.
Lauren's
I'm gonna
saying 8
give it
minutes.
till tonight. I'm gonna wait till tonight before she has one.
Oh, Casey's got faith
Oh
in
no,
her
she's
today.
got new ones in, so she's got to start off thick and fast to keep them like in there.
Literally, like.
How many she got? Do we know?
But the thing is, she has to work her new ones up to it, doesn't she? Let them know how sick she is and how unmanageable all these illnesses are for her. So once
I wish there was a cure to make everyone 100% better so no one had to suffer, but yeah. I don't think anyone's ever been 100% well in their life or in any, like in one way or another, 100% in any part of their life. Do you get what I mean? Like, 100% isn't really, I don't know. I don't know that I haven't personally, but I don't know what you mean by again, because literally, like, I wish there was a first time. I wish there was a first time I've been 100% Jesus. People go through what they go through, but, you know, it's not fair.
Everybody lies about it.
You know, life shouldn't be like it, but it just is. It is part of life. But we go through what we don't necessarily, we go through what we go through and it teaches us about life. Some of the pain all of us go through and some of the hurt and some of the heartache and some of the heartbreak actually the physical pain a lot of us go through actually isn't fair. But you know what I mean? Like, I don't think suffering should be fair, but I think some of the mental things people go through makes them better people, and some of the mental things makes people worse people. Like, it makes you or breaks you. But I do think the physical health stuff isn't exactly fair on people, and like us that fight chronic illness every day, yeah, I get you. It helps, but it has side effects as well and stuff like that. Yeah, I get you. I mean, I'm not going to talk too much about the big C, but yeah, no, I do get you, and it's hard. It's either do you fight the immediate now of like the management of everything that is going on with your body and with your health and with everything in your life, or do you look at the bigger picture and think, well, I just have to get on with it and I just have to do this, and you know, but then it kind of breaks you in different ways because you're just not really living because you're not managing, you know. I'm fine, lovely, don't worry. Because you're not managing because the symptoms aren't managed, you get what I mean? So then it dragged you down completely in other ways as well, because symptoms aren't managed, and then it makes you feel worse in other ways, and then...
How many 20 mil syringes has she had at this point? Because the max you can have down into your judge in one go is 120 mils.
A life at the end of the day, or part of a life, some sort of quality. Yeah, people are mean, darling, but it is what it is, like, literally. How did I get my paralysed stomach? I was born with it, lovely, unfortunately. I am lovely, unfortunately, yeah.
My God.
I go through pain 24/7.
Oh.
But I've got used to it.
It was 2 years, like this morning.
I've really got used to it, and we shouldn't have to get used to it. This is why I'm speaking so passionately about it, because we shouldn't have to get used to it. But we do.
Just to make it clear to everyone, we're not going to give the username out on this live.
A liquid barium when I was younger, and then a barium meal / a GES when I was a little bit older. But yeah, I can't give you the exact ages because, quite frankly, I don't know without the paperwork here in front of me. Do you get what I mean?
Thanks, Observer.
Misinformation.
No paperwork.
So basically, by studies and testing done, but yeah.
Well,
so it's basically
that's not the right testing for what you're saying you've got.
They like to do both, although they like to do the food at least.
She said before that no doctor wanted to test her for anything. Or study her.
Well, the doctors are in the right.
They X-ray up to 4, 1, 2, and 4 hourly, and sometimes 6 hourly if you're there for 6 hours. I did a 6-hour one. Ugh.
Oh, sorry, I was like, oh, Kylie's were going.
I was inpatient because I was vomiting a lot and
get a competition now. Just for shits and giggles.
The joys. So they admitted me after that, so that was great. Not.
Usually, I'm not saying everyone, but usually if you vomit during the gastric emptying study, then they stop the test because it's not going to be accurate because you're going to not have hardly any of it left in your stomach, if anything.
I was coping. Which wasn't particularly well, but it was better than being in hospital. Jesus.
She couldn't make it any more obvious the way she goes off to the side as she's putting it in, because she knows it's draining out the other side.
It doesn't do it straight away for me all the time, but yeah.
They're scooching up the bed there, paralysing the waist down. Yeah, right.
Honestly.
That's what I'm saying, Steph. She always hides that side of her face because she knows it drains out.
In the past 25 years of my life, if they could have done something, they would have done They would have done it, let's face it. So can we write off hospitals, please? I wish. You also have gastroparesis, which is on
She said she was discharged a couple of days ago.
I just don't, lovely. But I haven't had stuff into my stomach for so long, that's probably why. I would just be vomiting, lovely.
Doesn't she have Monster and Sweets on a daily?
And then vomit up, or I would vomit it up whenever it comes up. Whenever it decides to reappear,
I just wanted to say that she had all these meds at 4:20 this afternoon.
But yeah, it would just stay sitting there until it vomits up, essentially.
Every 2 hours.
I literally said it feels like she had them
99%
5 minutes ago.
So yeah, unfortunately, it would literally just stay there.
Yeah,
we've been on that long though.
Not at the moment, but is there anything they could have done in the early days? I don't think so, but I don't know. You came from the other life, the hate life, did you?
Thanks, Amy, for that as well.
Well, why are you here then, lovely, quite frankly?
Quite frankly.
And don't go telling me it's a awareness live, because it's not. Oh, sorry, lovely.
Shout out!
It goes straight into my intestines, lovely. The medications I take, I really don't know. I don't count them, lovely, quite frankly. I just take what I'm prescribed and that's that. But yeah. So my feed and my medication goes in here, which goes straight into my intestines.
Do that. Don't you have to be prescribed first?
Straight into my intestines. And then J-tube, nasojejunal. Thank you for the gifts, everyone. I really don't expect gifts, my love. You don't have to send gifts at all. I really don't. I don't expect them, guys, honestly.
Stop gifting her. Go on TikTok shop.
I'm sending my love to all of you, though. Oh, stop it, sitting down comedian, my lovely. Honestly, you're naughty. You send a rose and I say stop it, and then you send a bigger gift. Like, you're naughty. You all are naughty people. So thank you, my loves. This is where I put you all on the naughty step. Oh no, oh my gosh. Does anyone ever listen to me? Oh, no, I'm joking. I'm being dramatic now. But yeah. Stop it, guys. Jess, you're the naughtiest, Jess. Honestly. Jess, stop it, babe. Honestly. How long are you on the naughty step? Half an hour at this rate, love. You'll be sitting there all night. Come on.
She doesn't get it off the NHS. She asks for it on different sites and people send her it.
Why don't they do surgery? They can put a pacemaker type device, but the chances are it wouldn't work. It's only a 50% chance it would work. And actually, they won't do a gastric pacemaker surgery on me, love. So yeah, I've grounded you all, guys. You're grounded.
They don't usually do, as far as I'm aware, in this country, gastric pacemakers on anyone unless it's private.
Oh my gosh. Honestly, Lucy.
Did anyone hear that then when she read out someone's on there who's come from this chat?
Guys, stop it. Honestly, I don't expect any. Honestly, you don't have to do that, guys.
Did she say who it was?
She said, what are you doing here?
Oh,
yeah, she said, what are you doing here then?
How long? I don't know.
And they said to her that it's an awareness live, not a hate live.
Oh, yeah.
I went to hospital, sweet. It can't be changed by myself. I actually went to hospital about 7:45 this morning, or about 8 o'clock-ish. I left to go to hospital, but yeah.
Stephanie Russell was the one she put. I just wrote I've come from the other live.
So yeah.
Stephanie, was you blocked by any chance?
Yeah, did she block you?
You know, didn't broadcast it, obviously, but yeah.
She'd already changed her tube as well before 8 o'clock this morning.
Basically, go.
The carers came at 8 o'clock this morning.
Why do I need to have it changed so often? Because if it flips, So someone noticed this morning that my feed was draining. It was, because my tube wasn't in the right place and I was waiting for it to be changed. But I was still trying to run feed because I tried. You know, I tried that last.
He should say, no, it's not draining. That's my drink.
And it was. So I gave
she
my
got mad.
meds, but essentially they didn't work, so I had to just skip them. But I had to take my epilepsy meds again. And then, yeah.
And that's why she's hiding the other tube.
So
she got caught out.
So the nasojejunal tube can flip from my intestines back into the stomach, but an NG is just in the stomach.
The ASD special is in the live. Are they the ones that put the comment that they were a neighbour?
Just have to go with it because it is, literally.
Yeah,
To go with it because life is life and it carries on. Do you get what I mean? Hello, Donna, lovely. Thank you for the follow, darling. My days, yeah, it's been a day, darling. I can't say it's been good, but it's been a day.
Air ambulance, did you send her a card as well?
Life. It carries on. But yeah, thank you. Which side are they on? NJ, NG. Well, Ryle's tube technically, but NJ, NG, yeah.
She's just using the term there.
So they're the other way round to this morning, which this is the normal way I have it. Because this is a smaller
Googling today.
so they could fit it back in this side again. Because this nasal passage has a bit of scarring, unfortunately. Sorry, that's my electrolytes.
I thought it was just the lungs that were scarred.
Okay. Bless you, I'm sorry, lovely. Is that comfortable? Yeah. It's done in endoscopy, so it's not particularly nice, love, I'm not gonna lie. I've got
She's shaking again.
Or ME/CFS, chronic fatigue syndrome.
No.
Fair enough. Feeling for a drain in my stomach.
Doing
I don't have
someone
a
who says they
garden.
can't use their arms and shoulders.
Well, I have a slight bit at the front, but yeah. Oh gosh. Yeah, I've never had one up, but down, yes. I feel
That she brings all the boys to the yard. I love that.
Bless you, darling. I mean, my bowels have always been issues, shall we say, but yeah.
Has she ended the live? She's paused it.
Her internet's been playing up lately, so it might be that.
It was just the stare. Oh, she's back.
So I can't have it, so I have to. I survive on feed. Have I always had to shoot? No, not quite. Not quite always. I've managed a little bit of food in the past, but it never properly stays down, unfortunately. So yeah, I can't basically sustain myself for long periods of time without tubes. So they've trialled me without them many times. I've had tube in my abdomen as well to go through straight into my stomach and my intestines.
Just a shout out to Observer as well. Thanks for topping up those words.
So yeah, that's what I'm on about. I've had the peg J before into my obviously stomach and intestines for my stomach drainage and for my intestinal.
She's lucky I'm eating my Chinese right now because this really
had it changed 3 times. So yeah. Thanks, you're fine,
You
sweetheart.
better
Sorry,
share that Chinese.
I had to do something on here because I've got alerted to something.
She had cellulitis like 2 days ago.
I've got a McDonald's right now. I'm enjoying.
What
did you do then, Sam? You're all taking the mick now. I've had a chicken sandwich all day. That's not fair.
Hey, at least you can eat, Kirsten.
It's an operation.
Oh, I know, yeah. Sorry.
Kirsten loves a good Chinese.
Or an Uber Eats.
It also caused a lot of infections while I had it in, so it wasn't good for me. I get a lot of
Didn't she say like 2 days ago that they've said she's got cellulitis again? Looks fine to me.
Sorry, you were talking about flares.
She did. She said she had cellulitis. That's why we have now got a cellulitis Caroline somewhere.
Yeah, she said she thought it flared up again last night.
The added stress of an extra point of access to get infections.
I think she's forgotten as well that she said her blood sugars were dropping, because she seems alright now.
They did work for
Give it a couple of minutes. Once she stops doing what she's doing, she'll remember, because she'll look around. What can I do? What can I do? Oh, sugars. And that's when she'll go.
Nice observation. Where's the cold gone?
So it had a G port and a J port, basically.
Oh, yeah?
That was like years ago.
She had a flu jab today or something.
If my body would have worked with it, it would have worked better when I was younger than now, but yeah. It's not easy seeing other people eating, but yeah.
It's about the pneumonia vaccine as well.
8 to 10 weekly. Can be up to 12 weeks, but mine's 8 to 10.
It's very bubbly because she's got new watches.
Come out and do it, obviously. Yeah. The district nurses, yeah. Thank you. Yeah, literally, I answered just as she was saying. Oh, there we go. So, that's that first.
Lovey, what about your blood, sweet? Come on, sweet, your bloods.
Was that a bum?
Check your bloods.
Swallow, yeah. Do I live alone? I do, lovely, yeah.
Sugars, sugars, sugars.
I have carers that come and go, and I also have my family that come and go as well. So they kind of come and go as they please, to be honest. No, obviously my carers have times, but my parents come and go.
The one in the trousers is a pubic catheter.
It doesn't regularly block, actually, no. Which I'm very lucky about, like, how old am I? I'm 25, lovely. As do I manage? With my carers' help, trust me. It's not particularly great, but it's what I have to do.
New followers are about the central line yet.
I have nowhere else to live, so yeah, I can't live with my parents because, quite frankly, I mean, they live close, but I can't, frankly, live with my parents because their house is not accessible for me, so yeah.
Where's quite frankly, Caroline, are you here?
For all those ones doubting her, there is so much on TikTok that proves she's lying again and again and again. She's seen walking, she's seen eating, everything. Everything she says, she then denies saying she's never said it, but it's all there. Research her on Google as well.
I can't hear her.
I can't hear either.
Alex, you muted.
Yeah, I can't hear anything.
Oh yeah, Alex is muted. Give him a while.
Moved away when they went to uni. And because I've been poorly for my whole life, basically, like, yeah, just have this feed.
11 to 19 with an ED is not all your life.
We've just kind of separated because obviously they went off to uni and I just stayed here because that's, yeah, it's what it is. Life carries on. I can't get back up if I have a fall, but I'm in a wheelchair. I can't walk anyway, lovely. And if I fall,
Where's the falls pendant then?
Someone else can pick me up, realistically. But yeah, otherwise it's an ambulance call, but
Was that her blood sugar alarm going
discuss
off?
all my conditions, but I have a few.
Press the feed thing on.
Thank you, Lynn. I appreciate that, sweet. I just don't feel like naming my conditions has any help to anyone. Plus,
Yeah, she's live, by the way.
Oh, she always names.
That's okay, lovely. I just feel like naming conditions isn't particularly, yeah.
Yeah, that's what she does.
I've lost a few friends through chronic and through mental health as well, and it's heartbreaking, lovely. I really feel for you there. I lost a lot of friends through mental health. I've had a battle with an eating disorder when I was younger, but also still, it still live with it today. It was caused by my gastroparesis, unfortunately. But yeah, and I've lost friends to that as well, and that was really hard.
Yes,
But,
she's live now.
Unfortunately, not surviving their battle with theirs, and that's awful, very awful. Especially since I physically couldn't eat, even though
TikTok shop is a friend.
But my brain was told not to because.
Well, we love TikTok shop.
My body physically couldn't either.
We're not allowed to give her TikTok username.
They lost their battle because they just couldn't mentally do it, whereas it was just so different for me. And I was in an eating disorder clinic, I'm not gonna lie, but it was very tough because I was tube fed.
Are we allowed to give her a real name for people to search on Google?
Then we would just go around in circles, so that was difficult. And I lost.
I've just been saying K.
That's okay. I just want to also say
it's available on my profile, but just for the live purposes, I'm not saying it.
It's an ED, lovely. So it's technically mental health, but not really. Like it, I don't know. It's hard. It is a form of mental health, but it's not like raw mental health. It's a specialist part of mental health because it's with your brain, but it's also affects your body, but that's a symptom. But I also have obviously the gastro condition that affects my body, so both of them to battle together was hard, if that makes sense. So I can't explain it very well, but yeah. Leukodystrophy, I have heard of it. Only because one of my support workers had
Giving that next.
Give it 5 minutes.
Not my support workers, one of my carers had a son that had
She's completely lost me. I've got no idea what she's on about now.
a son or a
regardless
partner that had a son with it or something like that. But I've partly.
Doing what narcissists do, go around with God, I can't get my words out tonight. Word salad.
They talk a little bit.
Reels people in, and then she'll start with it all.
So I've heard of it, but not a lot about it, if I'm honest. Bless you, lovely. Oh, bless you, lovely. Oh, bless you. My sister passed away when she was young.
Yeah, she's live right now for those asking.
It's another thing. But yeah, I feel for you.
One of her favourite sayings is, I never said that.
To lose a sibling. I feel for you there, darling.
It's all I remember.
Like, completely, really relate there.
Say someone's just told her that their sister passed away and she just goes on about how hers did as well. It's just horrible.
Sorry, lovely. Sorry, lovely, I didn't do that. That was my mod. That was Lucy, darling, sorry. But yeah, my sister unfortunately passed away of either not of Etsy. I'm not sure where I got these actually. Yeah. Hang on. Oh. One sec.
Is that to disguise it a bit more?
Yeah, the pump's the wrong way around.
See, someone's asked about her sister and she's just going on about her stuff still. She will tell them, but she doesn't like it. You can see in her face that she hates talking about someone else. It's always got to be about her.
Oh, I'm so confused. I'm just going to say...
Body language and said it all.
There we go, that'll do. Yeah. No, sorry, I didn't send that, lovely. I think I've got feed all over my bed, for God's sake. Pumps do I have? I have...
Stain sheets again today.
Pumps.
Oh, she didn't keep that on pumps that long, did she?
Actually, either to go through this part or that part.
Don't those pumps make quite a bit of noise as well?
Or leakages at all.
They did when I had it.
So it just covers it up.
Yeah.
You don't know, I'm fine, Bex, it's fine. It's
Very
really
nice.
cool.
Yeah, my daughters did too.
The little wet patch will be fine, darling. Thank you. Thank you, lovely. I appreciate that.
Oh, the eyes are going.
What's the big sticker on my tube? Tape, lovely.
Look at talking now. She needs a break, so she's going to have a little fakey shaky.
Have a little nap.
She usually does it once she's connected a feed and a water, so that
it just put it out.
Then she's got an excuse to take it off.
Halloween tape, yeah. This isn't a sticker, lovely. Thank you, I appreciate that. It goes over the port of my
username will not be
Do I get out much? Not at the moment, unfortunately.
said on the slide.
Yeah, fair point. What happened to a jaundice? Where did that go?
Might get stuck too, but yeah.
Miracle, Kirsty.
It's a port cover, lovely. So you can either use it on the meds port. But I'm trying to use it. Because you can't really see that bit if you're further down.
He's obviously not had the yellow coloured light bulb delivery.
Fails, or if you've dodgily connected
that because I had last night.
Arthritis, and this one's start arthritis. And if I don't connect it properly, they obviously drips a little bit. So you get what I mean.
She's connected that after I shown that picture of how long, you know that one I shown before, Chronic Lives, with the holding the tube and the other one holding it out.
Exactly that.
Oh, no way.
I normally use a tubey clip as well. Do you? Normally, what I'd normally do is if I was in my wheelchair and this was in my backpack, I would normally then obviously put all that round, put a tubey clip round it and clip it like to my waistband sort of thing. But yeah. This is a drainage tube, it drains my stomach, lovely. So this is an NG, this is an NJ.
Surely she must get sick of like repeating the same stuff like 50 million times a day.
Yeah, I haven't got the diagnosis of my arthritis yet, so I don't know what type I have. I'm just waiting to go to the clinic.
Gracie's in both chats. Let's get Gracie to ask her something.
So yeah, that's hard.
There's rheumatoid arthritis before.
I have to go to hospital, but because my stomach doesn't work, lovely, unfortunately.
If you're a nurse and you join a chat or a live and you say something, she kicks you out straight away.
Yeah.
Doctor, she kicked out.
Machine. Pumps.
She says she doesn't like talking. She just said that she doesn't want to talk about diagnoses because it doesn't help anyone, but now she's talking about the diagnoses again.
It's me. Oh, and me. I forgot about me.
Yes. They're connected in. They are what are giving my feed and fluids right now.
I'm 100% sure now she has put that cover on because of what I said last night, because I said if you'd pull it down it'd be all the way to the ankle. She's put a connector on to make it look like the end of the tube's near enough down to her waist.
Does that, from that looks there though, she's got it draining down the other side, so it's not actually going up through.
It is going in, and it's it's going in and draining out the other side, like you say. But I mean, like, she's put that port cover on to make it look, and the connector to make the tube look longer than it is because of that picture that I shown last night.
Stop taking them. Like, get on with your own life. Do you get what I mean? Like, don't obsess over someone else's.
Because you're
the husband. E5.
Are we getting famous again? Oh, is she talking about us?
That's okay, love.
Wants to be in our group, and she's not a Caroline.
Kirsty, do you know how to pin a comment?
Yeah.
You can't pin when people are in the boxes. And we're not giving them more views by doing this. Their account's private.
People keep asking for her username. Say to pin it, but
we're not putting a username in anyway.
No, it's a bag attached to it.
No, I mean pin a message saying that it won't be given.
Oh, got you.
Can't pin when the box.
I don't like sleeping with these on. I have to, but I don't like it. I hate the noise. I still hate the noise to this day.
She had it on private this morning, and I think she said she only had 4 people in, so she wasn't happy.
Yeah, so she went public, accepted shitloads of people, and then gone back private again.
So the bag is connected, and it's like basically like a brick. Mine was a. Oh, do you? See, I used to have a.
Here we go, we're stroking the hair.
Yeah. I used to have one of the.
Got to go, Groggy.
Applex Smart. It was one that was about that big. That pump was horrible. It's not bad actually. It doesn't move underneath the tape, so it doesn't itch. It's the tape that itches. My face gets a little bit sore, but that's because my allergies are bad. So yeah.
Because you change it about 10 times a day.
She's 25.
Here we go, here we go. Ambulance, Caroline, are you on standby?
There's no light from these ones. You can turn the light off. But yeah.
PR, Caroline, can we have you on standby as well, please?
Caroline, are you there too?
Oh, she's looking a bit pissed off.
I haven't been able to go out for a long time, but I'm starting to go out with my carers soon, so yeah, that'll be good.
Do you know what? She would have been going out for about 2 months, and she'll still mention that she's not been out for ages.
Yeah, she's just said, obviously, she's not been out for ages. She said earlier she went out with her carer for a bit.
Out the night before last on her own and had a fakey shaky while she was out and was rescued by someone who knew what was happening to her.
That was a couple of weeks ago, that weren't the other night.
Was it?
Guys, because I think my parents will be, well, yeah, Mum would.
I thought she couldn't go outside because of her immunity and her Lyme disease and her lupus and everything else.
Because I'm knackered.
Remember when her mum had shingles but still come round?
And yeah, I'm quite tired. Just hit me like a brick, honestly.
We're going.
I'll see you guys later or tomorrow. Lots of love, guys. Bye. Good night.
Oh, she's gone off to have a fakey shaky. She didn't want to show us today.
Try going off for most of them now. She don't really do them on live anymore.
Because she knows she gets aired now.
That's what it is. I think she's sick of everyone watching her taking the piss. Gonna take the piss when she's doing it, and it's pretty obvious that it's fake.
And probably Mummykins has probably had something to say. Like, surely the parents' work colleagues and stuff are seeing it.
Yeah, but the dad don't give a shit, does he?
Oh, he just covers her. It's just as bad as she is.
Oh yeah.
It must cause fights between the parents, though, especially after they've lost one kid.
Well, it must do. I wouldn't like to know what goes on in their house, to be honest.
I reckon her sister, when her sister was poorly with the brain tumour, her sister obviously had all the attention, so now she's become this way because of that.
I said yesterday.
How many times are the mods going to ring her dad while they're on holiday?
Oh no, she said her auntie's going to be taken, or some relatives are going to be taken over.
Apparently.
Well, if she's having more carers, then why doesn't she have more carers all the time? If she had care leaders as high as she says she does, she'd have 24-hour care.
Yeah.
She needs
I get
serious
more
help.
hours than she does, and my care leaders are not as high as what she's saying hers are.
Bryony is saying she was a carer. Where's Bryony in chat? Someone's just said.
Guys, Bryony's saying she was a carer.
Oh, Bryony, banana with a pink bow, and then Bryony, her name is. She's got like a lollipop.
Would you like a box?
Yeah, I'm happy to step down now if you want to open a box.
See if I can invite her.
I think someone's gonna have to drop.
No, Alex, step down.
I'll drop. I've got to go in a minute anyway.
I've got to go soon, to be fair, but I've got to hear
She
this.
says she's a registered name.
She said, "Hold on, I'm eating my tea."
Hold the tea. Stop the tea.
That's okay. We don't mind you eating at the same time.
Oh no, we're really going to get the tea now.
Come
Where's
on,
my
Bryony,
popcorn?
quick.
Jason, this has entertained me though the past few days because I sit in the house. I haven't been able to go out for the past couple of weeks because my mobility is that bad at the moment, and this has taken my mind off it.
I wonder if Bryony was a private paid carer or council.
I'm waiting for...
Thing is, my care is done through social services, but it's a private company that come out to me that I pay for.
Yeah.
Social services pay for my care, but I'm pretty sure it's a private company. Like, it's a private provider that gives my care.
So I get review once a year to see if I need to up my package or downgrade it or whatever, and whether I'm happy. And I just have to redo the financial forms every year. That's all. I don't see my social worker all the time. I haven't seen my social worker since I had my care put in place.
I worked for a company that used to drive around to people's houses. Did you ever stay with her for 2 hours? Because she reckons she gets people for 2 hours.
A 2-hour call is a companionship call or a cleaning call.
The 2-hour carers have only just started, though.
Or a cleaning call.
The 2-hour carers have only just...
It was come for 30 minutes when it's meal times.
I get 2 hours in the morning, but that's only because they have to do medication and help me with the shower. Like, but like, the rest of the visits are not that long. The rest of my visits are only an hour.
Yeah, and she says she has to have like a strip wash and like a hair washed over a sink or something, but paralysed from the waist down, they would have a wet room done for her.
Exactly, well, I have a wet room. I mean, my house, I'm lucky, I've got a custom built, not custom built for me, but like custom built for wheelchair users, like wheelchair adapted bungalow. And it was a new build when I moved in, so...
Yeah, well, they'd lowered the countertops as well for her so she could reach.
Yeah, mine are rise and fall. Well, two of them are rise and fall. My sink and my cooker are rise and fall, and then there's one lowered surface that isn't rise and fall. Like, so the sink and cooker can be adjusted depending on who's using them. So I can put them low enough for me to use, or the carers can put them higher up for them to use when they're standing.
But like, she's supposed to have a power wheelchair as well, but when she scoots through the house, you never see a power wheelchair anywhere.
No, you don't.
She doesn't have a power wheelchair. She said she's not allowed one because of her epilepsy.
I've seen where she said several times that she's got two wheelchairs, a power one and on this one.
Not allowed one because of her epilepsy.
Oh, she's telling more lies again.
I've heard the same as. I heard the same as what Kirsty heard. She weren't allowed one because of
epilepsy.
Wheelchair services will not supply an electric wheelchair to anyone with seizures. Like, you have to have been a year seizure free to get one. But like, obviously, we all know that her seizures are bollocks, and she doesn't have this. A load of shit.
Well, she bought her wheelchair as well. Apparently it's custom made for her. But if you need a wheelchair services will get you one. It just takes time.
Especially if she's paralysed, she'd be top of the list to get one.
Yeah.
Exactly. Mine's from wheelchair services. I had to fundraise for some of it because my local wheelchair services don't provide chairs with a seat rise, and that's a really expensive part of the chair. The chair beyond I've met my needs, so I fundraised to be able to get one with the seat raise. But like, the difference between me fundraising and her is that I actually still needed it. Like, and I gave proof that I bought it once I got it. Like,
yeah, but sick, and he's already had free.
But a lot of times when it comes to the power wheelchairs, you have to get them through Motability.
Little Beep, who wants to contact and who?
And that was the other thing, and someone mentioned about PCOS. She got told she had cysts, so she jumped to PCOS straight away.
Do not get me started with the PCOS, because I have PCOS, and that's where my anger as well also comes in.
Yeah, I have that too.
My older sister.
That's no. Email, you can message me because my messages are open. I just have to accept it when I come off.
Yeah, they are full of it. That Dad has to scrape it out. I mean, who gets their dad to come and do that and also change the tampons?
Oh my God.
Yeah, she does that as well.
Like, surely you would get your mum or a female carer. But she can bend forward, so she'd be able to do it herself.
Hey, Hannah.
You can move our hands perfectly fine. You don't need to, like, just because you're paralysed doesn't mean you can't change your own tampon or family connection.
Can everyone mute, please, so we can listen to... Sorry, what's your name?
Bryony.
Bryony, sorry.
Yeah, sorry. Wait, hold on. Let me just change my settings so it looks like I'm not live. Wait there, hold on. I don't know how to do it. Hold on, 2 seconds. Yeah.